Hello, it's Dr. Rhonda Johnson. Today's Thursday, May 13th, 2021. And today I'm going to be talking about the news from the CDC regarding mask wearing and fully vaccinated people, and the big rollout of the Pfizer vaccine has begun, folks, in 12 to 15-year-olds. But first, the good news from the CDC. Well, fully vaccinated folks, that's people who have had their 2 doses of the Moderna, 2 doses of the Pfizer, or 1 dose of the Johnson & Johnson vaccine, and 14 days have passed since their final dose. According to the CDC now, fully vaccinated people do not need to wear masks. You do not need to physical distance in most situations, even indoors or in large groups. According to the CDC, fully vaccinated people can stop wearing masks and stop social distancing indoors or outdoors, with a couple of exceptions. And these exceptions are when on buses, trains, planes, and other forms of public transportation, or when you're in the hospital, doctor's offices, or other healthcare settings, you still have to wear a mask. That is so highly significant, and I'm sure many people are overjoyed to get this news. And why did they make this recommendation? Because there's overwhelming evidence that the coronavirus vaccines are extremely effective in the real world, even against these more contagious variants. Now, the CDC officials said that their guidance may change if the pandemic worsens, but for now, this is a huge step toward resuming normal life for most Americans. But there is a catch. You got to be fully vaccinated. So I say for the folks who are not fully vaccinated, again, what are you waiting for? Please do not allow your body to become one of the few willing reservoirs for this virus. If you're not vaccinated, you're still at risk for COVID infection. You're still at risk to infect others. You are at risk to get sick, hospitalized, and even die from this virus. Folks are still dying, but there are a lot less dying every day here in the United States, but that is not the case in other parts of the world. So you want to really reconsider your decision not to get vaccinated. And folks, those of us who are fully vaccinated, there's even more good news from the CDC, that even if we get coronavirus from somebody who's not vaccinated, we are a lot less likely to get very sick, a lot less likely to transmit coronavirus, and certainly not as likely to be hospitalized or to die from this virus. Now I'm going to switch to my second good news topic today. And that involves 12 to 15-year-old teens here in the United States. Today was day one that many of these young people hoped for, and they rolled up their sleeves in vaccine clinics, and some schools are vaccinating students. But across the United States, today the vaccine started for 12 to 15-year-olds. You know, these kids, they want to get on with their lives. They want to go back to school. They want to hang out with their friends. They want a summer this year. They want to go to summer camps and do things that they couldn't do last year. And they can't wait. They have been isolated. They've been depressed. They've been alone. They've missed their friends. They've missed their lives. So parents, yes, your consent is necessary. And I want you to remember that you have the opportunity to save our children from a virus that can infect and damage their brain, their lungs, their heart, their blood vessels, their skin, their kidneys, and cause widespread inflammation disease in their young bodies. Parents, if you don't want to protect yourselves and you haven't been vaccinated, I'm appealing to you to protect your children. Give this gift of prevention. The vaccine trials have shown the vaccine to have the same protection against COVID in 12 to 15-year-olds as it has in older adults. And the side effects are very similar. You know, parents, we protect, we educate, we nurture, we provide for our children. Now it's time to prevent COVID. That's what this vaccine will do. Are you on board? What will you do? Please talk to your children, talk to your 12 to 15-year-olds. And if you don't want to get vaccinated, that is your choice. But if they want to get vaccinated, let them choose their future. This is Dr. Rhonda Johnson. My views are my own. Please see my other video on the Pfizer vaccine clinical trial information. I'll include it in this message. As always, my views are my own, and my only intent is to help save lives. The best coronavirus infection is the one that never happens. So stay safe, folks, and get vaccinated.